Late pregnancy is a time when the excitement and anticipation grow, right along with mom's belly. In this chapter, Understanding Pregnancy, you'll learn about your baby's development in the 3rd trimester and how to stay emotionally and physically healthy as birth draws near. The 3rd trimester starts at week 29, lasts 12 weeks, and ends with the birth of your baby at around 40 weeks. As it progresses, the growth of your abdomen is accompanied by your baby's development. 4D ultrasound images like this one give us a special glimpse at what babies can do in utero during the 3rd trimester. As this baby rubs her eyes, you can see that her facial features are already unique. In this next ultrasound, you can see this baby lick his arm. His mother probably just ate a sugary snack that he's tasting. In this one, the baby's practicing how to move her hands and fingers. Perhaps she'll give mom a little jab by accident. While babies move around and explore the womb, important fetal development continues right up until birth. Their lungs mature, their brains are wired for thinking, and they gain the body fat needed to stay warm outside of the womb. As your pregnancy progresses, you might experience more emotional ups and downs than you did in the 2nd trimester. On top of the joy and excitement, it's common for expectant parents to be troubled by a wide range of fears, including financial concerns, the health of mom and baby, what labor will be like, and whether you'll be a good parent. Your healthcare provider will probably want to be notified right away if you notice any signs of labor before your scheduled surgery date. This segment will show you what to watch out for as your pregnancy progresses, and you'll hear from Jenny about her experience. Pregnancy typically lasts 40 weeks. If labor starts before the 37th week of pregnancy, your baby could be born prematurely. A baby who is born too soon may not be ready to live outside the womb and is at greater risk of serious complications. Call your healthcare provider if you experience any of the following before your 37th week: a change or increase in vaginal discharge, pelvic or lower abdominal pressure, constant low, dull backache, mild abdominal cramps, regular or frequent contractions, which are often painless, or uterine tightening, or a gush or trickle of fluid from your vagina. Attempts may be made to stop preterm labor to give the baby more time to develop inside of you. Planned caesareans are typically scheduled once the baby is considered full term, which is around 39 or 40 weeks. In fact, the National Institutes of Health states that planned caesareans should not be performed before 39 weeks due to the danger of having a baby whose lungs aren't mature enough to breathe on their own without problems. Tests may be done before the surgery date to help reduce the chance of delivering your baby too soon. An ultrasound test can be used to estimate your baby's size and weight. An amniocentesis is the only test that can tell you whether your baby's lungs are mature and ready for life outside the womb. To do this test, the healthcare provider uses an ultrasound to find a pocket of amniotic fluid that is near the surface of your abdomen and away from your baby. A needle withdraws a small sample of this fluid for testing. An amniocentesis is not a routine procedure. It may only be recommended if there are special concerns. While your own labor will be a uniquely personal experience, all labors follow the same natural process that brings about the everyday miracle of birth. In this chapter, Understanding Labor, you'll learn about the different stages of labor, including the physical and emotional changes you'll experience as you give birth to your precious baby. Once labor begins, it's impossible to predict how long it will last because every mom and baby is different. Typically, the entire process lasts anywhere from 6 to 24 hours or longer. Your labor will progress through 3 distinct stages. During the first stage of labor, contractions cause the cervix to thin out and open. The second stage of labor includes pushing and the birth of your baby. In the third stage of labor, you push out the placenta. Now let's take a closer look at the first stage of labor, which is further divided into 3 phases: early labor, active labor, and transition. We'll start with early labor. This animation shows the changing cervix. During early labor, the cervix starts to efface and dilate, which means to thin and open. In this phase, the cervix dilates to 3 centimeters. This contraction graph shows the length, frequency, and strength of contractions. Early labor contractions are short, lasting only 30 to 45 seconds, and are spaced far apart, giving moms 5 to 30 minutes of rest in between. Early labor can take many hours, typically lasting 6 to 12 hours for first-time moms. In labor, your emotions will most likely reflect what's happening inside of your body. During early labor, most parents feel excited since their labor is underway but contractions aren't strong. They may also be a little anxious about how labor will progress from here. For generations, women have relied on tried and true comfort measures and loving support to cope with labor discomfort. In this chapter, Understanding Comfort Techniques, you'll learn an assortment of time-honored natural pain relief methods that work by engaging your mind and body. One very effective comfort measure is the use of breathing to reduce discomfort. While there is no magical breathing pattern that can take away the pain of contractions, breathing does help in many ways. It makes your contractions work better as it brings oxygen to your uterus. It aids your baby's descent because it relaxes your abdominal and genital muscles, and it gives you something else to focus on besides the discomfort you're feeling. As a contraction begins, take a deep cleansing breath in through your nose and out through your mouth. Continue with slow, deep breathing throughout labor. Each inhale brings strength, while each exhale pushes out pain.
As far as breathing techniques, I just made sure that I did deep breaths in and deep breaths out and just focused on my breathing in. I also counted during my breaths, so it kind of made me see how many more breaths it would be before the contraction was over.
You might find that faster-paced breathing may help with stronger contractions, especially during their peaks. Adding a pattern can be helpful and adds a greater distraction. There's no right way to breathe during labor. If a certain technique or pattern is helping, then it's right for you. Being able to relax is essential to coping with contractions, so set up your labor room with this in mind. Set the lights low if desired, and adjust the temperature to what feels good to you. Playing music or using aromatherapy scents can be soothing.
Time out for 5 minutes. Maybe you'll get a halftime. No?
Doubt it.
Yeah.
Halftime is for sissies who get epidurals.
Oh. That's true.
Smells like cigarette. Can you close that door? Ugh. I don't know if you noticed, but when you closed the door, she was making like direct eye contact with me, like staring at me.
Was she? I saw her staring in here.
Yeah.
And that's why I closed it. I just saw her walking around like looking in. Fuck that.
Yeah, thank you. She was like just about to say something too.
I figured she was gonna say something. Make it really awkward or come to the door, then it'd be even more awkward.
Mm-hmm. You could just use the excuse you didn't see her and you didn't know I was there.
Yeah, I just closed it up. I don't think we need an excuse. Do I need to make a sign? Mama in labor.
I feel like that would draw more attention. Because then she's going to be like, oh, they're in labor. Like,
peeking through the window.
Yeah. And what if she like is one of those crazy people that thinks it's like totally bad to have homebirth and calls the cops on us or something, and then yeah.
Trauma. I think if she told the cops they're giving birth.
Oh. Up a little bit. Yeah. Oh, fuck. Fuck. Oh. Oh. Oh.
Do you want to try the ball?
It hurts. It's the only thing I can do. Oh.
Oh, do you want music?
Yeah.
What do you want, Regina? India? Wow, what's Bigfoot doing over there?
Jax.
After birth, babies go through an amazing transition from life in the womb to the outside world. They begin to breathe, regulate their own body temperature, and nurse from their mother's breast. The best way to help your baby adjust to life outside the womb is simply to hold her skin to skin with no blankets or clothing between you. Studies have shown that babies who are held skin to skin right after birth have more stable temperatures and blood sugar, breastfeed sooner, longer, and more easily, and even cry less. The more time you spend holding your baby skin to skin after birth, the more benefits your baby will receive. The most common reason that a baby is taken away from his mother right after birth is for routine evaluations and procedures. Most of the time, these procedures can wait until after you've held your baby for a while, or they can be performed while your baby's in your arms. Holding your baby the moment he or she is born and throughout the first hour or two after birth can also be a profound time for you to bond with each other. Having your baby stay in your hospital room is an ideal way to extend your bonding time and to continue all the benefits your baby receives from being held. But after giving birth, you will probably be very tired, and it may be tempting to send your baby to the nursery so that you can get some sleep. Fortunately, research tells us that you are likely to get just as much sleep with your baby in your room as you would if your baby were in the nursery. And babies who go to the hospital nursery at night tend to cry more and are more likely to have trouble breastfeeding than babies who room in with their mothers. Find out what your hospital's newborn practices are ahead of time and tell your healthcare provider and nurse that you plan to keep your baby skin to skin after birth and in your room for the rest of your stay. If the hospital policies require having many routines done in the first hour, consider choosing a different birth setting.
I think holding her skin to skin, I don't think anybody should do it any other way. I remember in the beginning I had told Brian that, I didn't want to have to deal with any of that and I wanted her clean before I even got her. But when I went through my birthing classes and childbirth classes and they kind of told us the whole skin to skin contact and what it does and how it helps regulate everything, and I completely changed my mind about everything, and I don't think I would have done it any other way.